Microsurgery means using an operating microscope. So you're there looking into this microscope binoculars, and then underneath the microscope is where the patient is.
Okay.
And so you're looking at these binoculars with your hands here with a very magnified
wow.
view.
Okay.
And so your magnification at the lowest power, I think, is about 4x.
Okay.
And at the higher end of the magnification is 20x, or maybe even a little bit higher than 20x. But there are some surgeons who just use magnifying loupes, which are literally magnifying glasses attached to their glasses, and that magnification goes anywhere from 2x to 6x. That's the highest.
Okay.
And so why is 6x the highest magnifying loupe? It's because of your focal distance. It's an optical reason.
So you're looking
so
like this.
If you have a 6x loop on, and you move like this, you're out of focus. And you move like this, now you're in focus. So any number higher than 6x is really impossible to work with a loupe. So realize that the guys who work with loupes, and the best that they can do is 6x, but with my microscope, or the people who do microsurgery with their microscope, we do 20x, we can get a much more precise connection.
I see.
And so the sutures that people who use loupes, the sutures that they use are bigger.
Right.
So the size of the suture gets smaller as the number goes up. So you have a 1-0, a 2-0, a 3-0, a 4-0 suture. That's how the suture is getting smaller with that increase in number. So someone who does the reversal with loupes might use 7-0, which is very small, but the microsurgeons will usually use 10-0.
Okay.
So that's a suture that is 17 times the diameter of a single red blood cell.
Oh,
so
wow.
It's much finer than hair,
Wow.
these microsutures that we use.
Yeah,
And
people
that's how
talk
you can get
about hair and we think, oh yeah, that's super fine, but wow, blood cell size, that's
Right.
incredibly small.
So that's how and it's all about getting the perfect reapproximation.